Good morning and good afternoon, distinguished guests, ladies and gentlemen. Welcome to the 2020 EEN Online Healthcare Forum, Smart Healthcare and Technology Innovation in Taiwan. This is Virginia from EEN Taiwan. The COVID-19 pandemic has seriously impacted the global economy and changed the way we live this year. And it seems the second wave pandemic is coming. Many cities have been locked down recently. The global digital health market is driven by a rising demand. Companies should focus on developing new operational strategies to respond to pandemic impact. It is also important to understand the latest industry trends to reimagine the performance. This will make us more likely to survive and take the lead in the COVID-19 world. Before starting our first topic, please allow me to welcome Mr. Brian Lee, the Deputy Executive Director of the Market Development Department at TAITRA, to share his opening remarks.
Hello, everyone. Good morning to viewers from Europe and good afternoon to audience from Taiwan. On behalf of TAITRA, the Taiwan External Trade Development Council, it is my pleasure to welcome you to EEN Online Healthcare Forum, organized by Taiwan's Bureau of Foreign Trade, TAITRA, and Zenit. First of all, I would like to thank Mr. Juan Carmona-Schneider from Zenit, who is also the chair of EEN Healthcare Sector Group, for acting as co-organizer of this forum. Zenit is owned by the state of North Rhine-Westphalia in Germany. It aims to assist enterprises, universities, and research institutions in finding partners worldwide. His team also organizes the EEN International Healthcare Brokerage event at the world-famous trade fair, Medica. This special year, when the event has to go online, we are glad to have 16 Taiwanese enterprises joining the event. I hope that the EEN brokerage event will be a great success and all participants will find partners for cooperation. Today's forum, we will focus on smart healthcare and innovation technology in Taiwan. As an aging society becomes a global reality and the COVID-19 pandemic has created significant challenges in many countries, the government, industry, and academia are eager to develop strategies to support the entire healthcare sector, which is being forced to implement intelligent solutions to reshape healthcare. Therefore, it has become mainstream nowadays for hospitals to utilize technologies such as AI, big data, VR, the IoT, and wearable devices to improve care delivery and make the best use of valuable resources. In line with this trend, further innovations are expected to boost precision medicine and preventive medicine in hope to significantly improve the quality of patients' lives. It is also the key to maintaining the industry's sustainability. TAITRA and EEN Taiwan are pleased to invite speakers from the leading Taiwanese hospital, ICT company, and potential startup to share their experiences of seizing on market trends in this industry. We are pleased to welcome Dr. Tsai, Director of the Clinical Innovation and Research Center of NCKUH Hospital, who leads the development of medical imaging AI and industry-hospital cooperation. Her team developed an AI-based pneumonia detection platform for COVID-19 that won the COVID-19 Global Hackathon. Today, she will elaborate on the impacts of ICTs on Taiwan's smart healthcare. Our next speaker is Dr. Cheng, founder and CEO of MagicLOHAS. He is also the founder of the Health Tech MRI Center, which conducted the first body MRI screening for cancer and cardiovascular disease in the world. He is ranked as a top 100 doctor by the well-known Taiwanese magazine Business Weekly and is dedicated to providing trustworthy and affordable health care. His medical team integrates wearable devices with an AI platform. He will speak about digital therapeutics with virtual reality, providing a unique experience in the mental and rehabilitation field. It can also be used for healthy people for telehealth during the pandemic period. Last, we are pleased to welcome Andy Lu, Smart Health Director of ASUS Cloud and ASUS Life. His specialty is IoT solution planning, and he has extensive experience in well-known companies such as ASUS Tech, Lite-On, Wistron, Foxconn, and Motorola. He will share with us the smart health solutions for smart cities in the EU, a project that originated from EU Horizon 2020. We're working with 12 other countries. TAITRA is a leading nonprofit trade organization in Taiwan, supported by the government and various industrial associations. We have 63 overseas offices to help foreign businessmen to find partners in Taiwan. Due to the COVID-19 pandemic this year, most of our services have gone online, taking forms such as online forums and B2B trade meetings, and our exhibitions provide online and offline services to keep the industries connected. EEN, Enterprise Europe Network, is a unique network comprising over 600 business organizations located throughout the EU and beyond. It aims at assisting small and medium-sized enterprises to develop businesses, innovate, and grow on an international scale. TAITRA, representing EEN Taiwan, is one of the contact points of the EEN networking, which supports Taiwanese companies to explore business opportunities with EU partners. We are sure that this forum will be informative and useful, and it will enhance business cooperation between Taiwan and EU. If you have any business inquiries, please do not hesitate to contact EEN Taiwan. We are willing to organize online matchmakings for those who are interested in doing business with Taiwanese companies. Thank you for your participation. As the world is facing a second wave of coronavirus, I believe that we are more prepared to fight the pandemic together. I sincerely wish everyone good health as well as success in your business endeavors. Thank you.
Thank you, Brian. And next, I'm excited to introduce our distinguished guest, the chair of EEN Healthcare Sector Group, Mr. Juan Carmona-Schneider, to deliver his opening remarks. Guten Morgen, Juan. This floor is yours, please.
Hi, Juan. Dear ladies and gentlemen, thank you very much for the nice introduction of that and what we are doing. It is really an honor for me to speak with you, to introduce a little bit what we are doing together. And it's really great that we can make this webinar today on smart healthcare technology innovation in Taiwan. This is really something which I appreciate a lot, that we can show to the participants of the healthcare brokerage event what you're doing in Taiwan and how advanced you are. I have to say, as a chair of the sector group healthcare of the Enterprise Europe Network, that I'm very happy how active the Enterprise Europe section at TAITRA is. And this is not since one day, it is since years. And they are one of the most active partners, and this is really great. As you may not know, or yes know, I have been in 2018 and 2019 with the European delegation at the Medical Taiwan. We have seen this great show and this good opportunity to meet interesting Taiwanese companies going around the fair, but also to have this transnational brokerage event. The European delegation wanted to come this year again in 2020, but as you know, as we all know, due to the COVID pandemic, it was not possible as we wanted. But Yes, we plan it for next year. So we'd like to come again to Taiwan and to see what you have developed, what are your products, and to look what we can do together. And yes, the cooperation was successful. We have some cooperations fixed over the last years. For example, my client Alan Plus, who found some interesting and good and reliable suppliers in Taiwan for his business in Germany. So Taiwanese products sold in Germany and from Germany also in Europe. I think this is a way to cooperate. It was said that a huge number of Taiwanese companies, 16 I think at the moment, are participating at the healthcare brokerage event, but it is not the first time. Taiwan is participating since 4, 5, 6 years at this healthcare brokerage, which I'm organizing now for 20 years. And I think that this is a good opportunity to meet Taiwanese companies and European companies, but also others maybe from the US or Canada in these things. So today is our second meeting day of the Enterprise Europe Network and Healthcare Brokerage event, and with I think about 100 bilateral meetings. I wish them all success, which they are looking for and they need. And the next meeting days are here in Medica in 16 to 19 November, and then after Medica again in January to March. So you can still register and become more successful. My wish is to come next year again to Taiwan to strengthen the links between Zenit and TAITRA, to strengthen the links between North Hemisphere and Taiwan. Thank you, Virginia. And thank you, TAITRA, for this wonderful webinar.
Dankeschön, Juan. Vielen Dank. We hope to see you in Taiwan next year. If you have any questions or feedback regarding this forum, please fill in the questionnaire. The links can be found in the video descriptions. We'll have time for Q&A sections at the end of the forum. And now, let's welcome our first speaker, Dr. Yi-Shan Tsai, the Director of the Clinical Innovation and Research Center at the National Cheng University Hospital. She will introduce the impact of ICTs on Taiwan's smart healthcare. Please.
Hello everyone, I am Dr. Yi-Shan Tsai. Today, I will share my experience about cooperation with ICT in Taiwan's smart healthcare. I am the Director of Clinical Innovation and Research Center of National Cheng University Hospital, and you can call it CIC. I lead the development of the medical imaging AI and the industry hospital cooperation of NCKUH now. Here is the outline of my talk. Introduction of the CIC in NCKUH. Cases of NCKUH smart healthcare. Collaboration experience with ICT. The CIC in NCKUH is the service unit for smart healthcare promotion. CIC has functioned for internal integration of different medical data sets. CIC also leads the industry hospital cooperation of NCKUH. We have project manager in CIC, provide single contact window, online application, and the spatial consultation. We try to simplify the process of industry hospital cooperation. We have already has 51 registration cases and 23 cases closed. We also help NCKUH set up all kinds of data sets and cloud computing for big data analysis. Here are cases of smart healthcare in NCKUH. The first one is about the AI technology applied for COVID-19 outbreak. NCKUH quickly set up clinical decision decision supporting system and the pneumonia detection AI model at our quarantine station. These methods reduce patient waiting time to 20 minutes and shorten the contact duration between medical staff and the patient to lower the probability of infection. Next, my colleague Professor Guan used her design, hot thermal for real-time temperature monitoring. This device is an innovative wearable device for continuing monitoring of body surface temperature and heart rate. Its cloud-based surf platform also predicts fever and the discomfort of the individual in real time. The IoT system is effective in monitoring of the body temperature for our medical staff in this pandemic. Here is the extended application of pneumonia detection AI model, which won the COVID-19 Global Hackathon. We further designed our AI model into a classification model for COVID-19 pneumonia or non-COVID-19 pneumonia. We work together with the Taiwan National Health Insurance and use the NHI chest X-ray imaging database for AI model training and achieve an accuracy of 93%. Next. Here is our real case for cerebral hemorrhage. Before we deploy the AI alert system, there is about, let's talk about the architecture of medical imaging AI in our hospital. We train imaging AI model for AI alert and AI assistant to improve our workflow. We send in instant message to the medical staff when the patient with critical situation, such as aortic dissection, brain hemorrhage, and pneumothorax in emergency department. All these processes are automatic and repeated in every 2 minutes. Here is our real case for cerebral hemorrhage. Before we deploy the AI alert system, there is about 10% patient with safety warning time more than 10 minutes. The cerebral hemorrhage AI model achieved an accuracy of 87% and the automatic detection of cases in emergency department every 2 minutes. We reduce the notification loading and the warning time of technology effectively. Another AI alert system is also applied for cases with pneumothorax. The AI model achieved an accuracy of 99% and automatic detect cases in ER every 2 minutes too. This AI alert system can facilitate the triage for emergency department patient and improve the quality of patient care. There are many AI projects in NCKUH, including medical image, cardiovascular biobank, ER and ICU dashboard, precision medicine, and some AIoT. All these projects are intended to improve our workflow and the patient care. The more important thing is to provide affordable precision medicine, and it's our ambitious vision. In addition, the 5G technology is important for telemedicine and the AIoT. Let's talk about the collaboration experience with ICT. ICT can provide technology as the backbone supporting AI, communication, cybersecurity, and cloud technologies to ensure data privacy and information safety. We need ICT to assist the hospital dealing with the data lake or data warehouse for mining the diverse medical record. The ICDS can accelerate the development of AI model or clinical decision supporting system too. The AI or machine learning-based software as medical device is called SAMD. It's totally different from traditional medical device. The AI algorithm with characteristic of black box, so FDA certification is necessary for commercialization of SAMD. There are several different types of AI or machine learning-based SAMD. CADE for detection and the CADT for triage are the most common intended use. CADX for diagnosis and the autonomous diagnosis system need more solid evidence for verification and the validation of modern performance. Product lifecycle-based regulatory framework is also recommended as modification from real-world data was commended by FDA. So, how to start an AI project with hospital for ICT? Unmet need initiated by doctor firstly. The intended use should be clarified. For academic research, improvement of workflow or commercialization. Selection the right topic with the potential of commercialization is the first issue for both sides. Expert review facing the marketing, industrial analysis, and the business model should be at the early stage of cooperation. There are many steps and the difficulty for SAMD. Data access and the privacy issues, lack of expert labeling, overfitting and the imbalanced data, complicated integration with different medical systems, retraining system for decline performance of AI model in real world. We also have to deal with the IRB document for the ethnic issue. Before FDA certification, at least 3 clinical research organizations are needed for verification and validation, and it costs a lot. So we can say that there is a tough road for SAMD certification. Finally, I have some suggestions for ICT to start smart medicine. Familiar with cross-sectional language for better communication, clarifying intended use, evaluating investing results, discussing the profit distribution and the sharing risk at the early research and development stage. If your team has the potential with successful SAMD, please prepare the business model and the marketing strategy as early as you can. Industry-hospital collaboration is the key for ICT to participate into smart medicine and not only just for sale product. At last, I will share some conclusion from the Director of Value Innovation Center in ASUS cooperation. The team has spent a lot of time for Taiwan FDA certification. Formerly, we think algorithm is the king of AI. Then we think the data is the king. The FDA is the king. Now, how to deploy the AI model into the hospital system is the main problem. And I agree with Professor Xu's opinion. Business is the king of successful medical AI in the future. Commercialization and marketing should be planned for any SAMD. And that's all my talk. Thanks for your attention.
Thank you, Dr. Tsai, for sharing this informative presentation with us. If you have any questions regarding this topic, please don't forget to fill in the questionnaire. Before jumping into the next topic, Rebecca from TAITRA would like to share the information about Medical Taiwan. Rebecca, this floor is yours, please.
Thank you, Virginia. Hello, everyone. I'm Rebecca. I'm glad to be here to do a briefing of Medical Taiwan for you. This year, Medical Taiwan combines 4 main fields: medical devices, smart medical, health products, and care products. Innovation and rapid technological development in smart healthcare have been the trend in the global market. Taiwan sees the trend to upgrade and transform our industry. Gathering the core fields in the medical industry, Medical Taiwan creates the most comprehensive platform to showcasing the cutting-edge medical technologies. 2020, Medical Taiwan focused on epidemic prevention ecosystem and smart medical. 202 exhibitors using 430 booths showcase the latest medical products and technologies. It also attracted over 8,000 visitors to join the show for business, more than 14 growth in visitor number compared last year. Medical Taiwan rebuilt business networks beyond the border control and travel restrictions through 4 online merging offline events. Visitors can explore offline innovations and new products in the medical industry. This is Medical Taiwan 2020, and we expect to see you next July. Thank you very much.
Thank you, Rebecca. And now I'm going to give the short introductions of the Taiwan's anti-COVID-19 pavilion. Before that, let's see the video first.
We have seen countless acts of bravery and sacrifice from medical workers around the world. It is our duty as global citizens to give them our full support. Pandemics cannot be stopped by one country alone, and Taiwan stands ready to do our part.
Taiwan's success did not come out of sheer luck. Taiwan is one of the few countries in the world that have not imposed lockdown on any cities. Residents in Taiwan are able to go to work, study, and perform daily economic activities as usual. This is because Taiwan has learned the lessons from SARS in 2003 by taking a series of actions in governmental reorganization, medical care system, and the public engagement. Another contribution from the public is the wide applications of big data analysis and advanced information and communication technology. This June, TAITRA launched the Taiwan Global Anti-COVID-19 Pavilion to enable both the public and private sectors of the world to acquire the relevant information and services from Taiwan. We are in this fight together is our mission. The Pavilion integrates the work of experts from different areas, including more than 20 leading medical organizations, provide real-time service to answer needs through video calls that share anti-pandemic experience. And this also provides lots of experience sharing from experts and online cinemas. Moreover, it's a database for connected with more than 2,000 business that provide over 10,000 anti-COVID-19 items, equipment, biotech and software system, as well as technologies and applications in public health, smart health hospital, remote working, and so on. We hope this website can provide solutions to you. If you have any concern about the pandemic, you can find more details on Facebook or contact TAITRA. Thank you. And now let's move on to the next topic. Please welcome Dr. Cheng, the founder and CEO of MagicLOHAS. He will present the digital therapeutics by using virtual reality. Please.
Hi. Good morning, people in Europe, and good afternoon, the people in Taiwan. It's my great honor to share some experience for you about the virtual reality application in the medical and the healthcare. As we know, the virtual reality has been applied in the medical education, such as surgical theater or for anatomical laboratory. But today, I would like to share more about the virtual reality application in the therapeutics aspect. So the first part of the talk will be talk about some of the review current practice in the market. And the second part will show some of the works with preliminary works for you. I would like to look back the history of the internet. The first wave of the internet is about 1995. It's about Yahoo or Amazon. They come from 1994. This is most of the internet is PC based. And the second wave of the internet is phone based, like the smartphone, like the HTC or the iPhone. That is 2007. And during the last decade, the people experienced the service of the internet. We are almost cover everything, but most of the experience are limited in the 2D. But now we are moving to the third wave of the internet. There will be the 5G plus AI, as well as the cloud. And I think our experience will not be satisfied by the 2D. People would like to have more immersive experience with explore the unlimited the possibility. There will be the next generation, the new communication. Actually, now we are living in the real world, so everything is real, but the real is limited. If something is unlimited, it's virtual. Everything has come from our mind. So in the next decade, I believe our imagination cannot be limited. So we need to have such as the AR and the VR. What is the augmented reality? That is, we project something, the virtual in the real situation, real environment. That is so-called the AR. The people may be like the game, the Pokemon. It's a kind of fun. But how it can be applied in our real life, especially in the medical care, there can be kind of the practice training, no matter in the patient or the professionals. And the VR is totally virtuous. In that situation, it's very good for the brain training. So this year, the FDA approved the first digital drug. That is for ADHD. What is ADHD? That is attention deficit hyperactivity disorder. It's a quite common disease for the children. They are hard to learn, but now the people can get, the doctor can give the drug for the kids. However, it has some side effect. Now we can go through the neuroplasticity. That is no any side effect. It's kind of the video game. FDA claims that software can be the medical device. So this is the first one, the digital pharmaceutical company without any chemical. This is ICTs. I think this is a breakthrough. So the first digital drug, and that is approved by phase 1, phase 2, phase 3 study, and that is very effectively to help the children get more concentrate. And now the second one will be last month I just visited Shanghai Yi-Shan Hospital. They conduct the phase 1 clinical study for Alzheimer for 99 elder people. They has mild cognition impairment, and they find that they're quite useful. Now they are conduct the second phase, the phase 2 clinical study, and people may consider the elder people may be with some dizziness or vertigo when they have the gargle, but very fortunate, they don't. They have very good compliance for the virtual reality, and they also apply this technology for the screening. Now they want to conduct more than millions of people, senior people in the Shanghai, using the VR goggle, have quick screening of the dementia, because the first symptom occur is for the elder people. They have some recognition of the vision. So, actually, the last month, the other company, so-called Applied VR, they also get FDA the breakthrough award. They use VR for pain control, and the other company is so-called behavior. They use VR for addiction or for help the people to cope with the stress. Even like they can use the guided mindful and use cognitive behavior treatment. Even for some the women, if want to have the pregnant woman, they have the labor, they can reduce the stress and reduce the pain. By the way, this year FDA also approved the other ones, the so-called real immersive system. They can be a tool for therapists. They help they use the system for stroke people. When they're doing the physical therapy, they can help the therapist more quantify and more standardize the treatment. So I think that VR will become more and more application in the Medicare. The other one is for so-called digital sedation or so-called virtual analgesia. When the people in the hospital, they get the treatment, no matter for the chemotherapy or the burn care, there's the pain. So using the VR, because the people, the attention is very limited. So when they're more attracted by the VR, so they will distract the pain, so this is kind of the non-pharmaceutical analgesia, and this won't get any addiction and can repeatedly use. So the other company in Europe, they develop a system so-called OncoComfort, help the people doing the chemotherapy to reduce the pain or stress. Then I would like to briefly introduction our company. Our company is the Exaspace. We developed a new hardware and software platform for the next generation of the virtual reality. We are the world's first 5G social VR. We we connect the device and we connect the people. Used to the VR is very isolated, it's very immersed. However, it's very isolated experience. Nobody know what you are doing. Now we can cross device. So in our system, our therapist can interact with the patient in the virtual world. They can have the interaction, and their family also can use the phone or pad. They can look into the virtual world. They can know how they interact. By the way, we also can project the virtual world to the TV. So in the next room, the teacher can teach the medical students how to interact with the patient. So in our system, the most important that we break through, we cross all the devices together. We consider the gargle should be one of the devices and connects all the devices together and connect the people, so people can be in the virtual world and interact with each other. So the therapist can interact with the patient directly, or one therapist can help a lot of several patients in the different location, but we can in the virtual space, in the same space, and has the interaction. Especially in the pandemic period, this patient may be hard to come to the hospital, but we can do the therapist together. And we also can apply this in the classroom to teach the students. So the teacher can be prepared the material, put it in the cloud, and then people can get the classroom together. Our device is very intuitive. Most of the control, we are using the voice recognition. So we see the virtual reality plus with the virtual voice recognition and use the gesture. So very intuitive. So people is very easy to hand on. So we don't have to connect to any PC. So it's just very mobile. So we can not only for the typical classroom, but we also can have the small group discussion, and we have many interactive. We can have the virtual whiteboard, and people can discuss with the remote. And by the way, in the virtual reality, we have the so-called the spatial audience. So the people can talk to each other like the real. When you close the people, the sound you can hear. Once you lift, the sound will diminish. So it's very easy. It's not like the room. When you talk, then everybody know what you are talking. So in this virtual space, you can very dynamic to conversation with anybody you want to talk. So this is why we work with TAITRA. We'll prepare the first VR trade show that welcome the people can join with us in the virtual world. During the pandemic, one of our colleagues gets sick. He get a leukemia and treated in the hospital. But we can visit him because it's not allowed, because he is in the isolated room because he do the bone marrow transplantation. We cannot visit him. But very fortunately, we use a goggle, so we can visit him together, and we bring him to the beach. Of course, it is virtual, and we can talk. And then we can see the movie, and we watch the sports together. And he said he almost forgot he is a patient at all, because every conversation is so natural. And we don't go to the hospital, but we can see our friends, our family, our family once they sick. So this virtual reality, sometimes we can use even in the medical, the environment. It may be not the treated people, but it make the people more comfort, because the people can accompany with your family together. Then I would like to introducing the other company. This is MagicLOHAS. Actually, MagicLOHAS is a new startup company. We are a group of the medical professional. We have the physical therapist, the occupational therapist, the psychiatrist, the pediatric psychiatrist, and physiologist. And we want to use this technology of the extra-space technology to apply in the health. So we say the digital wellness. Now we work from home, and then we can work out at home. So we apply the technology, have the Tai Chi, Pilates, and the cycling at home, but all of your data will be transferred to the cloud. And then we can use our AI phone and let me. So people can, in this virtual world, and then you can do the cycling, you can do the Tai Chi, all this expert trainer are online, but they are not in the YouTube, that is 2D. You can put a tracker so we can measure everything you did, and we do the analyze and help you to collect what you do. So you can work out with your friends in the virtual world and your teacher also in the virtual world, and you can do the meditation. And then we have your personal health record. We can recognize what you did. So we consider there can be not only the telemedicine, there could be the telehealth. It's not only the exercise, there could be the precision exercise, because your exercise can be measurement and analyzed and by the tracker, by the EKG, and by the EEG. And then we can prevent the spot injury, and then we can have the virtual gym studio, your teachers, your trainer, and your doctor, your therapist, everyone in all over the world. But we can work together, and you can work out and the gaming together. Want to make the people during the pandemic, you can enjoy the better life. So that is our mission. We want to bring this. Actually, VR is not a new technology, but we just want to make it simple and easy to use in your daily and in every day, in everywhere, with everyone you want to be together, that you can enjoy the better life during the pandemic. We want to people have a good health. Thank you, everyone.
Thank you, Dr. Cheng, for sharing these creative and innovative virtual reality applications with us. Please do not hesitate to fill in the questionnaire if you have any further questions for Dr. Cheng. And now, let's welcome our final speaker, Andy Liu, the Smart Health Director of ASUS Cloud and ASUS Live. Please.
Pause. Participatory urban living for sustainable environments. That's what I want to share our experience to you. Hello, everyone. I'm Andy. In the EU, we would like to know how EU they do and implement for the smart health solution, especially for smart cities. And I also would like to share what kind of the key points that they are concerned at. The first one, post-introduction, the cooperation opportunity. Then I will give you some update for the implementation methods and the result. Then experience of our how to join for this program event in the EU post. The first one, per data, around 55% of the population worldwide live in urban areas. Urban environments play an essential role in shaping human health and well-being. So based on these kinds of the data, the two issues just happen here. The first one, public health challenge. Another one is the urban lifestyle effect. Disease of the respiratory system are one of the main causes of death in the EU. Asthma is a common disease that affects people of all age worldwide. Another one is the urban lifestyle effect. Globally, 11.3% of deaths are due to diabetes. Always half of these deaths are in people under 60 years of age. They're just very important and take more serious for our behavior, okay? Because we just live in the city, and our food. So, two kinds of the very serious point to impact our body and attack our behavior. One is air quality, another one is our lifestyle effect. So what is the post, the version? The first one, transform public health from a reactive to a predictive system, focus on both risk. So most of the people, we are under considering about how to take a solution for the reactive only. But we still need to take more the serious considering about the predictive. Predictive is the most important. Public health risk, asthma, and the T2B, T2D, we call the type 2 diabetes. In the EU, they are also thinking how to increase the interest for the human. So you can see that shift public health from a surveillance-based system to an inclusive and collaboration system via citizen engagement. So empowering the citizen through a science approach using the POSER app. So the user, the human, can use the app, the POSER app, to do some interactive between the program and for both of us. So also they were sharing the impact of the population and the health status to the citizens. So fostering citizen responsibility and awareness on air quality. Another one, they do some analysis. Minimize environmental and behavior risk of disease incidence and via an integrated system of sensor, app, and data to do some analysis in detail. Methods of assembling and presenting the big data on environmental and behavior risk and the analysis. So tools and the technology to change our behavior. The postal ecosystem building with the local initiatives. So you can see that the slide we just showed have 7 cities to join the program. Of course, Taiwan, we choose the Keelung. Keelung is close to Taipei City, but the Keelung is most of the independence we can control, and not many the people, okay, in the Keelung. So that's why we choose Keelung to do a demo site for the post-program event. Consortium, we also join, and the Valid, LMD, and LabStack. Yep. All of the Europe and all of the worldwide the company and the hospital, university join this program event. So cooperation opportunity, we also have the recommendation of the HBA. So you can see, Taiwan the flag, we join for the EU, this kinds of the program event. Another one, let me to introduce for our post implementation math and the result. This slide is to show our the city and the population assessment. From the government, we call this kind of open data. So public health organization to collect all of the vital signs, all of the environmental, the signal. And for the citizens, we also have the physical GPS, personnel data, and the sleep data collect together. So come out these kinds of the big data, we can build a training model to do the site like the T2D risk, asthma risk, well-being index, and the air pollutions. Based on these kinds of the training model, and we use the algorithm, machine learning and the deep learning to do that. Health risk models, like for POS, we also have the portable sensor, like this one is an ASUS, the third generation of the smart health watch. We collect all of the data from the personal via the vital sign signal. Then we use the app. Then based on the air quality, we will build out the predict models of T2D and the asthma onset. So you can see that the model's training on the data set. The MESA ELSA is from the UK. In the EU, for this program event, we access the data from the MESA and the ELSA from the UK, the database. Then we build the training model and do some analysis. Then we can output the feedback to citizen from the app. Puzzer, that means is we also to build an application, the software in the phone, so you can do some interactive. Dashboard for public health organization. Human, when you work on the city, the cell phone can push the message to you to give you some suggestion on this side. How about the air quality, the impact? So you can do some interactive, and you can get to know early oh, where I want to go that the air quality is bad, so I cannot go there. So for this kinds of the dashboard, we can push the message from the government system to your cell phone. Another one, intervention tools. Of course, not only to give you some recommendation, we also give you an intervention tools. Also give you an interactive. So community or practice in the EU, they are wish everyone, the company, to join this program, to share 100% to share your experience, your technology. So we need to build a website so you can see that share our experience. Every company to join the program, we have to build a website to share our experience, our result, and our technology. So for the T2D type 2 diabetes risk assessment, for the scenario 1, we do not put extra the risk and the condition on the data analysis. So you can see the risk, the index is a 0.81. Even we add in scenario 2, we add some kinds of black graphs. just increase a little bit. That means our AI is close to 100% of the correct. For the post website, I just mentioned, I just give you some present before. So let me to share for our experience in the EU post. It's also post member. In the last year, the event in Taiwan, in Taipei, in ASUS headquarters, we are invite all of program members to come to Taiwan to join us for the yearly the membership. So Taiwan can help. Taiwan can do more because we have the data platform to use the smart. We have OmniCare, an interface to collect all of the medical devices of the IoT level. And we also have the AIoT. We have very powerful the algorithm. We have very good the machine learning and the deep learning. So we have the intelligent, the capability. We also have a convenient. So we have a Taiwan open data, can do many kinds of the application for the environmental, medical, health promotion resource. The next project, because ASUS to join this program event in 2018, until now, we get more successful performance on these kinds of the project. So we already award the next project called the Gatekeeper. The Gatekeeper, the objective of the project is to create the connect healthcare providers, business, elder citizen, and the communities they live in order to organize an open, trust-based. So we were joining for this kind of a Gatekeeper project. And we also, to join this pilot site project, we choose these 7 items for the program event. Finally, thank you very much. And we will do the successful and welcome everyone to join us for the Europe program for the smart health solution in the smart city. Thank you.
Thank you, Andy, for this valuable experience sharing, and thank you for all the speakers for this informative presentation. We have collected some questions for today's speakers from the online audience. Thanks to my colleagues for assisting with this. It seems the first question is suitable for all the speakers. Some experts mention it might be high entry barriers such as healthcare policies, regulations, and other issues for ICT companies to enter healthcare sectors. Would you please share your experience when participating in the cross-sector project? Dr. Tsai, please.
I still have some suggestions for ICT who want to start smart medicine. First, you should be familiar with the cross-sectional language for better communication. You have to clarify all the product intended use, and you have to evaluate your own invested resource and discuss with your partner about the profit distribution and the sharing risk at the early R&D status, and always prepare the business model and the marketing strategy as soon as possible and as early as you can.
Thanks, Dr. Tsai. Dr. Cheng, please share your viewpoint.
Actually, the medicine is an applied science. And ICT is high-tech. So these two sectors should learn through each other. For medicine, we don't need too much advanced technology, but we need to have the mature technology. So each other should be dialogue to know that I think most of the initiation should be from the medical profession. They need to ask the right question first. Otherwise, no matter how much technology you have, it won't be useful. So we need to define the question first and consider the scenario or the situation that happened. So then use the technology ICT to solve, to make it more efficiently or effectively. So it takes time to know each other. But I have to mention, the question is the first. To find the right question is the first. To define what we want to do. Don't be too ambitious to do too much things. Just focus. You solve one issue and make clear and go the next step. So I would say the more important, people have to have the long-term commitment to each other, because in the ICT, they might change very fast. The iPhone 1, iPhone 2, iPhone 3, they change in every year. But for the medical professional, they don't want to change too much. Everything once we use, at least 5 years or 10 years, because we want to stability, reliability, and the trustworthy. That's just the most important that we concern. So we don't want to too much fancy. So people should know I think the culture and the mindset should be reset and work together and has a long-term commitment. That's very important. Don't do any short way. Yeah, thanks.
Thank you, Dr. Cheng. Mr. Liu, please share your opinion about this.
I am ICT guy. I got more and more failure experience on that. Most of the IT guys, we just based on our previous experience, and we want to implement our IT solution in medical side. It's a total wrong. We need to deep consider and to understand how the medical people, the nurse, the doctor, what they are thinking that. What is there the urgent request issue? How to support them, how to solve their problem, that is the first important. Not just focus on the IT capability, the IT experience, and to implement the IT solution. Cannot do that. So my suggestion is that we have to leverage and to talk with medical guy more the detail and deeply. Also, if we want to promote our solution to the worldwide, we have to leverage the local distributor, the local solution integrator, then combine together. I call this is SPA. SPA means a strategic partnership alliance. We need to take a SPA together, okay, then to make successful business model. Thank you.
Thank you for your useful experience sharing. Our next question is for Dr. Cheng. How can the use of VR in health impact consumer behaviors? How do you anticipate health-related VR involving in the future? Please.
As I mentioned before, actually the VR is not the new technology, and VR has been applied for many people in different situations. So the problem is the use of VR. So that is, sorry, I forgot to turn on the microphone. I just repeated that the VR actually is not a new technology, but the experience is very bad. It's very cool. You can provide very immersive experience, but very inconvenient for the people, no matter the patient or therapist or the doctors. So Today, we want to make a new platform that can connect the people and connect the device together. Want to make it more easy and friendly, very intuitive to use it. And actually VR or AR has been applied in many different applications. So we're trying to find all this application has been proved that is very useful or valuable. Want to take then there's some previous people have done and apply to our system to just want to make it more simple and useful. That is want to do. So I think with the AI technology and the cloud computing, and they can make it a very convenient to use. So I think there will be, but I think this was still a very small segment, not the big segment. The big segment is still the chemical pharmaceutical, but the digital pharmaceutical will take a small part and some unique space, as I mentioned, especially in the cognition and the mental disease. They will be very useful. For the healthcare, I will consider the meditation will be very powerful. Now the people get more stressful in works, and the meditation, you can do it in your home, and that make you more overcome. So that is I expected what want to. Thank you.
Thanks, Dr. Jen, for the answer. And next, how can AI and data analysis help in controlling the spread of the current pandemic? Dr. Tsai, will you please share your thought?
Yes, I think this is possible. We can use many medical imagery, medical record, and some data from the IoT, and you can build up some AI model to predict the disease spreading, just like we build up the pneumonia AI model to detection the lesion first, and we try to classify the pneumonia is COVID-19 pneumonia or non-COVID-19 pneumonia, and you can try to collect the imagery and put the series image data. You can try to predict the disease severity and the illness of the time course, and you can do some prediction and some disease prevention. So I think the AI and the big data and the imagery and the chart and all the clinical information are useful to build up the AI model to help the current pandemic controlled. Thank you.
Thanks, Dr. Tsai, for sharing. Our next question is also for Dr. Tsai. So, if you could implement any innovative technologies within the hospital to make a difference, what would it be? Dr. Tsai, please.
I want to develop an integrated system like a dashboard. We can put all the EMR medical information and the AI-powered medical image or AI-valued prediction model or clinical decision supporting system, pathology or genomic data with all-in-one displays. And I want to build up some custom-tailored user interface, and it will reduce tons of time for doctor to loading the pages between different medical systems. So doctor can spend more time to the patient, not to the computer system. I want to develop one integrated system to solve the problem. We waste too much time to use the different medical systems.
Thank you, Dr. Tsai, for the answers. And final question is, we have seen many amazing innovations positively impact the experience of patients, staff, and clinicians in healthcare. What is required to optimize these devices from a network and infrastructure standpoint? Mr. Liu, would you please give us an idea?
For the innovation of the device, most of the IoT company, they just focus on the edge level of IoT devices, like the portable smartwatch, like some kinds of the collection for the signal of the devices only. But here, I would like to point out two keys we have to take a deep monitoring. The first one is a communication networking capability, speedy. Due to the 5G is coming, the 5G, the efficiency and the speed is fast, and the system is stable. So, if we want to achieve the good performance for the smart blah 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 solution, the first one, we need to take more the considering about how to build up a good and smoothly and fast the communication networking system is the first one important. So we needed to leverage the 5G, the system, the 5G solution, because we need to process huge the image, right? So we need a very powerful the 5G system. That is the first one. The second one, most of the IT company ignore that. There is calculation, operation capability. If we want to do a smoothly the efficiency for the data analysis, even we combine the AI algorithm, machine learning or deep learning, we need a very powerful the GPU, like the GPU server. So we need to build up a very powerful the operation capability that can fulfill the huge the data processing. So that's why I point out two kinds of keys would like to focus. The first one is the networking of communication system. Another one is our operation calculation capability we also need to build up. Thank you.
Thank you, Mr. Liu. Thank you for all the questions online and answers from our professional speakers today. We hope you've received tons of valuable information from the speakers. This forum has come to an end. If you have any questions or feedback, please check the links in the descriptions or contact EEN Taiwan directly. Follow EEN Taiwan for the latest news. We look forward to seeing you in the future. Have a lovely day. Thank you.